All right. Hey, everyone. Welcome back for another deep dive with us.
Yeah, glad to be back.
Today we're diving into something pretty crucial, especially if you're keeping tabs on what's happening in India. And honestly, who isn't these days, right?
Right.
We're talking about the link between health and sanitation. Specifically, we're going to zero in on those big nationwide initiatives that Prime Minister Modi has been spearheading, the Swachh Bharat Mission, or SBM, and the Jal Jeevan Mission, also known as JJM.
Exactly. And we're not just going to skim the surface here. We want to give you a real in-depth understanding of how these initiatives are not only changing the face of public health in India, but also impacting things like gender dynamics and even environmental sustainability. It's all connected.
It really is.
And we're drawing all of this from a super comprehensive article in the Hindus. You UPSC aspirants out there, this one's especially for you. This is like front page news stuff.
Absolutely. So much good material for your prelims and mains prep in this. Okay, so let's jump right in. First up, SBM, launched back in 2014. A lot of people, when they hear SBM, they think, okay, toilets, building toilets. But it was so much more than just that, wasn't it?
Oh, for sure. You hit the nail on the head. The real heart of SBM was this idea of Yanandolan.
Yeah, I remember that term.
Basically, a people's movement. It was all about sparking a massive shift in how people thought about and approached sanitation. I mean, you can build all the toilets you want, but if people aren't using them or understanding the importance of hygiene...
Well, it's not going to do much.
Exactly. It was about creating a national mindset of this is important for all of us, and that grassroots energy was a big part of what made it so successful.
And successful it was. I mean, India got declared open defecation free, ODF, in rural areas by 2019, which is huge, especially considering those global sustainable development goal targets. Like, we're talking hitting those goals ahead of schedule.
Absolutely. It was a major, major milestone.
So for someone who's not super familiar with this stuff, what does being ODF actually mean? Like, on the ground, what's changed?
So in simple terms, ODF means that communities have completely ditched the practice of open defecation. And that's not just about having toilets available. It's about every single household actually using them regularly. It's about making sure the entire sanitation chain, from having the facility to using it and then properly getting rid of the waste, becomes a normal everyday thing for everyone. And, that's when you start seeing the real public health benefits kick in.
Which brings us to the Jal Jeevan Mission, JJM, launched in 2019. So while SBM was all about sanitation, JJM tackles the other biggie, access to clean drinking water for every rural household.
You got it.
Seems like a natural progression, building on all that progress from SBM.
Exactly. It's like two sides of the same coin, right?
Yeah.
Clean water and proper sanitation. They go hand in hand. And with JJM, it's not just about throwing down some pipelines. We're talking about a serious investment in people, in their potential.
Yeah.
Nobel laureate Dr. Michael Kremer, his research is actually highlighted in the article.
Oh, intriguing.
And it suggests that if everyone had access to tap water, we could potentially prevent something like 136,000 child deaths every year.
Wow, that's a powerful statistic.
Yeah, it really puts things in perspective, doesn't it?
Absolutely. Like, we're talking about saving lives on a massive scale.
Absolutely. And, the WHO estimates that it could even prevent over 400,000 deaths from diarrheal diseases. And when you think about how those diseases tie into overall well-being...
Yeah, it affects everything.
Everything. Clean water is like the bedrock of a healthy society. For you UPSC folks, understanding how access to water directly impacts public health, that's gold.
Yeah, that connection is so key. But it's not just about physical health either, is it?
Yeah.
I remember reading about how these missions, especially JJM, have led to some really significant social changes, particularly for women in rural areas.
Oh, absolutely. And this is where it gets really interesting, I think. So JJM is expected to save a mind-boggling 5.5 crore hours every single day for women in rural India.
5.5 crore hours. That's almost impossible to wrap your head around.
Yeah, it's a huge number. And think about it, before, they were spending a huge chunk of their day just fetching water.
Yeah, carrying those heavy loads.
Exactly, often from really far-off sources. Now, with tap water right in their homes, all that time is freed up.
So what are they doing with all that extra time?
Well, lots of things. They're getting more involved in agriculture and other economic activities, which boosts household income and empowers them financially. Then there's the reduced physical strain and health risks from not having to haul water around all the time. And let's not forget the safety and dignity factor. They don't have to go to these remote, sometimes dangerous places just to get water anymore.
Right, that makes a huge difference. And I'm guessing for UPSC prep, This ties in nicely with topics like women's empowerment, rural development.
Absolutely. It's all connected.
So we've got these huge efforts in sanitation and water access, but what about the concrete results? Like, what's the data telling us?
Well, the numbers are pretty impressive. The WHO estimates that over 300,000 diarrheal deaths were averted between 2014 and 2019 in India. And that lines up perfectly with the time frame of improved sanitation under SBM. It's hard to ignore that correlation.
Yeah, that's a huge reduction in deaths. Really shows how impactful even basic improvements in sanitation can be.
And there's more. The Gates Foundation found that children in areas that hadn't yet reached ODF status.
So they were still practicing open defecation.
Yeah. They had a 58% higher rate of wasting. That's a type of malnutrition,
Yeah.
And that just shows you the direct link between poor sanitation and kids' health, how it can really stunt their development. It's a wake-up call, for sure.
Absolutely. That statistic about child wasting is really striking.
Yeah.
Shows how crucial sanitation is, especially for the little ones.
Yeah. And there's a UNICEF study from 2017 found that 93% of women felt safer and more secure after getting a toilet inside their own homes. We talk about health outcomes, but that sense of safety and dignity, that's huge, too.
Absolutely. It all contributes to a better quality of life.
For sure. And then there's the economic side of things. Rural households are estimated to be saving around $50,000 every year in healthcare costs thanks to these improvements.
That's a lot of money.
Yeah, it is. And that money can then go towards other essential needs like education, better food, all that. It's like a ripple effect,
A positive cycle.
Exactly.
So we're seeing these benefits at the household level even.
And then environmentally speaking, less groundwater contamination. That's a big long-term win. It keeps your water sources clean, protects public health down the line. It's all about sustainability, really.
It's all linked, like you said. Better sanitation, cleaner water, healthier people, healthier environment.
Exactly. And what's really cool is how India's been weaving these initiatives into their broader rural development plans. It's not just isolated projects here and there. It's all part of a bigger vision.
Right. I remember reading about the Sujal and Swachh Bharat campaign.
Yeah.
That seemed like a good example of that integrated approach.
Totally. It's like bringing everything together at the village level, clean water access, promoting hygiene, and managing waste effectively. It's about creating healthier, cleaner villages from the ground up, tackling all these interlinked issues as one.
And our source mentioned some pretty impressive numbers when it comes to waste management.
Oh yeah, the progress has been remarkable. Over 5.07 lakh villages have got systems in place for solid waste management, and then another 5.23 lakh villages are managing liquid waste properly. Those are some serious numbers. And it shows how committed India is to building a preventative healthcare model starting right there in the villages.
Yeah, it's about shifting the focus from just treating illnesses to actually stopping them from happening in the first place.
Exactly. And women have been at the forefront of all this. They're not just benefiting from these changes, they're driving them.
Right, they're key players.
Absolutely. The article had some great examples. Over 2.48 million women have been trained in water quality testing. So they're the ones making sure their communities have clean water, that it stays clean. And then you've got these women-led self-help groups. They're running sanitation infrastructure, even making affordable sanitary pads. It's like health, economic empowerment, community ownership, all rolled into one.
Wow. That's really inspiring stuff. Shows how much can be achieved when you empower women, give them the tools and the knowledge.
Yeah, it's a powerful message. And, it highlights the fact that real public health, sustainable development, it needs people to be involved, to own it. And women, they're often the backbone of that.
Absolutely. And the source also made a point of saying that public health, it's not just a health ministry thing. It needs everyone to work together.
Oh, for sure. Realizing that health isn't just about hospitals and doctors, that's huge. It's about clean water, sanitation, nutrition, education, how developed the area is. It's all connected. We're moving away from this idea of each department doing its own thing to a more collaborative approach. And that's key for these big initiatives to work.
Makes sense. It's like a system, right? All these different parts need to work together.
Exactly. And, India has really become a model for other countries, especially those in the global south facing similar challenges. This whole water and sanitation revolution, the way they've done it, it's like a blueprint.
So what are some of the key takeaways that other countries could learn from?
Well, for starters, that emphasis on changing behaviors. It's not enough to just provide facilities. You have to get people to buy in, make sanitation a shared responsibility. Then there's that focus on community ownership. It's about making sure these initiatives are relevant to the people they're supposed to help, making sure they're sustainable. And then, of course, that collaboration between different government departments. It's about everyone being on the same page, working towards a common goal. All that, plus strong leadership and smart use of technology, that's the recipe for success.
And I think the article also talked about how India is willing to share their experience to help other countries achieve those sustainable development goals.
Oh, yeah, definitely. There's a real sense of global responsibility there, a willingness to say, hey, we've learned some things, we've made some mistakes, here's what worked for us. It's about working together to make things better for everyone.
Absolutely. So wrapping up, I think it's clear that this focus on clean water and sanitation in India, it's about so much more than just infrastructure. It's about improving lives, empowering communities, building a healthier and more sustainable future.
Couldn't have said it better myself. The successes of SBM and JJM, they really show what can be achieved when you have strong leadership, people working together, and a smart use of resources and technology. And, for all you UPSC folks out there, understanding these missions inside and out, that's crucial for your prep. Knowing their goals, how they were implemented, the impact they've had, all that good stuff.
Exactly. And as India keeps moving towards becoming a Viksit Bharat, this whole transformation of their water and sanitation landscape, it's a story worth paying attention to.
Yeah, it is. And it leaves us with a really important question. We've seen how connected health, sanitation, and overall well-being are. So what do you think, dear listener? What are the next big things that need that same kind of nationwide, all-hands-on-deck approach, both in India and around the world? That's something to think about.
Yeah, definitely something to ponder. And for everyone preparing for those UPSC exams, remember, this topic is super relevant to your understanding of India's development strategies, public health initiatives, and how they're progressing towards those sustainable development goals. Definitely go back and check out that article we mentioned in The Hindu. It's a gold mine of information.
Yeah, it is.
And if you found this deep dive helpful, please do us a favor and hit that like button, subscribe to the channel for more deep dives into all sorts of fascinating topics. And hey, we love hearing from you, so drop us a comment below with any thoughts or questions you might have. Thanks for joining us today.
See you next time.